the knee joint, the more complex joint in our body. And it's not that allows a lot of movement, it's a modified hinge joint. So mostly provides flexion, extension of the leg at the knee, review those movements, and a little bit of medial and lateral rotation, especially when we're going to unlock the knee, when the knee is flexed, and when we're going to unlock when we go from standing to standing to flexing position of the knee. Articulating surfaces. What do we have? We have the femur. Remember, in the distal end, we have these two bumps that we described on the lab, and these are the condyles, the femoral condyles. So on the same side of the head of the femur, we have the medial condyle, and this is the lateral condyle. We also have this smooth area in here. There is the patellar surface that articulates with the patella or kneecap right here. Okay? What else? The tibia. The thickest bone in your body. Let's describe the articulating surfaces. We have again two condyles on the same side of the medial malleolus. That's the medial condyle, and this is the lateral condyle. And they articulate with the medial and lateral condyle of the femur. And then, which bone is this one? The fibula. Does the fibula takes part of the knee joint? Does it? No. Just like in the forearm, the radius is not taking part of the elbow joint, the fibula is out of the picture. It's not, I'm going to show you this one that is already articulated. Look at the baby. Okay, so you can see in here the articulation between the two condyles of the femur, the two condyles of the tibia, and look at the fibula out here, out of the picture, not forming part of the articulation with the femur. And in here we have the patellofemoral articulation. So we have three articulations in one. The patellofemoral is the articulation between the patella and the femoral and the patellar surface of the femur, and two tibio-femoral articulation between the medial and between the lateral and lateral condyles of the femur and tibia, and between the two medial condyles of the femur and tibia. So, since both are condyles on the femur and the tibia, we call this a bicondylar articulation. Okay? And modify hinge articulation because besides providing flexion and extension, it can provide limited rotation, medial and lateral rotation. It's not like that. It's very subtle. Okay, it's maybe like this. Okay, what are we going to find? We're going to find the capsule. So this capsule is quite different from the one that we have been describing that wraps the entire joint. In this one, this capsule is going to wrap the lateral, the medial, and the posterior aspect of the joint. So it's going to be something like this. Okay, and it has the same two layers, the outer fibrous layer and the inner synovial membrane. The anterior aspect of the joint is not protected by the capsule, but by the patellar ligament and two more ligaments that are called the patellar retinacula ligaments, the lateral and the medial. And the patellar ligament is just a ligament between the apex of the patella and the tibial tuberosity of the tibia. It's kind of a continuation of the quadriceps tendon. The quadriceps tendon attaches the quadriceps muscle of your thigh to the base of the patella, and continue to that, that tendon is followed by the patellar ligament that now is attaching to bones, right? That's a ligament between the apex of the patella and the tibial tuberosity. Now, the articulating surfaces, here we can see these are the two femoral condyles, and we cannot see very clearly, but under these blue things in here, we have the tibial, like in here, we have the tibial condyles too. And they, again, are covered by the articular cartilage that consists of hyaline cartilage. Um, the inside is lined with the synovial membrane. We don't have a great picture in here. Well, in here, look, they cut the capsule in here, and we can see part of the inner synovial membrane that produces the synovial fluid inside the articulation. Now, inside the capsule, we're going to find a lot of things. Not only intracapsular ligaments, but also cartilage, pieces of fibrocartilage, for the meniscus. So, or the menisci. The meniscus, this is the medial meniscus and the lateral meniscus on the same side of the fibula. They are pads, again, of fibrocartilage that resist compression forces that we applied over the knee joint, and they have the shape of a C. Can you see it right in here? See? 1 and 2. What else? Inside the capsule also we're going to find two ligaments, the cruciate ligaments. We have the anterior, and this one is the posterior cruciate ligament. What it says, if it's anterior or posterior, is the site of attachment on the tibia. So this is the anterior cruciate ligament from the anterior aspect of the tibia. It's located, both of them are located towards the midline. So from the anterior cruciate ligament, from the anterior aspect of the tibia to the posterior cross to the posterior aspect of the femur. And the posterior cruciate ligament does the opposite, from the posterior aspect of the tibia to the anterior aspect of the femur, and they cross like an X. Let me show you this in here, like they're crossing. This is the anterior because it attaches anteriorly in the tibia, an ACL, anterior cruciate ligament, and this is the posterior one because it attaches in the posterior aspect of the tibia. And see that they cross like an X. This is the anterior, this is the tibial tuberosity, so I know this is anterior, and this is the posterior, the PCL. The function of that is just, can you see how it's holding the anterior cruciate ligament? Is like holding in place the tibia, so allows or prevent actually the forward movement, the movement of the tibia into an anterior plane, and the PCL, the posterior cruciate ligament, avoids the backwards movement of the tibia. Okay, let's close now. Before closing the capsule, let's describe it one more time in here. So we can see here the articular cartilage, hyaline cartilage lining, covering the condyles of the femur, the condyle of the tibia, the patellar surface of the patella. We can see the yellow background, which is the synovial fluid within the synovial cavity. We can see follow the synovial membrane. So that gives you an idea of the extent of the synovial cavity, all of that. This synovial membrane, it is synovial membrane, but it's not inside the synovial cavity. So this is not part of the joint. What is this? Look, this one is between the bone and the skin. This one is between the ligament, the patellar ligament, and a little piece of fat in there. What is that? A bursa. That's a bursa. And it's lined with synovial fluid because they're synovial membrane because they're filled with synovial fluid. Look in here, the meniscus, or the menisci, and the anterior cruciate ligament and the posterior cruciate ligament. Now, let's close the capsule. Superficially, or the external aspect of the capsule, consists of the fibrous layer of the capsule. And that capsule is reinforced, let's see, medially by this ligament that is called the tibial collateral ligament on the same side of the tibia. Laterally is reinforced by the fibular collateral ligament on the same side of the fibula, lateral, and that avoids again lateral movement of these the bones of this joint. And remember, we don't have capsule on the front, just on the side and posteriorly. And posteriorly, the capsule is reinforced by the popliteal oblique ligament. You don't need to know the name of the ligaments, just that it is reinforced by all of those ligaments, and also by the action of muscles, specifically the ones that provides more stability to the joint is definitely the quadriceps muscle and the semimembranosus, which is one of the hamstrings. Movements, remember, can you see? Flexion, extension, and a little bit of medial and lateral rotation to unlock the knee. That's it. Enjoy and love joints, especially if you're going to, if you're taking the beautiful path or sports and fitness, and you need to take kinesiology. You're gonna describe after the mechanics of all of these joints and all of these movements, the degrees and blah blah blah. So especially if you're following that path, it is very important for you to master. You have to be a master in joints, bones, joints, and muscles, and nervous system. See you in the next chapter, muscle tissue.